AHPN is a network of networks that's looking to meet the health needs and social care needs of one of the UK's fastest growing communities, that's the African community. AHPN is quite unique in the way we influence and shape policy. We hear the lived experience. We really do value the day-to-day realities that people have to go through. We engage with our membership through a series of networks, through a series of organisations. We give them a platform to actually have their voices heard.
The AHPN was set up because a significant number of people infected and affected by HIV in the late 80s, early 90s were actually Africans. So the African HIV Policy Network has now morphed into the African Health Policy Network, broadening the conditions that it's actually addressing to include cancer, diabetes, mental health and also tuberculosis. These are conditions that disproportionately affect Africans or people of African descent. And we've broadened it out to be people of African descent rather than just people who come from the continent.
Now that we're working on a broader range of health issues, it's allowing us to see where the same issues are affecting different health conditions. So we're specifically interested in the wider determinants of health, things like immigration and poverty and poor housing. One of our policies that's really worked is Destination Unknown, our campaign around immigration and particularly about the removal of people from the UK back to countries where treatment is not accessible.
What makes AHPN special is that we are the only ones at policy level advocating on behalf of the African community. So far, we've delivered that effectively with the programs that we have been delivering, for example, the NIPE program.
Good afternoon, AHPN.
The authority of the African Health Policy Network has always been around its membership. The membership is made up of community organizations, but they can only implement policy. If the AHPN did not exist, the voices of small community-based organizations, those myriads of networks, their voices would never be heard and their needs would remain unmet.
FENA is a network of Africans and Caribbeans living with HIV in the United Kingdom who come together and share experiences to influence policy and to empower themselves through training and taking part in campaigns. And actually it's a group of activists.
That's where we learned how to lobby, how to campaign, how to speak to our MPs.
Since I've joined FENA, as a long-term survivor with HIV, I've learned that there's a lot that we didn't know about the after effects of the medication.
I lost my confidence for many years ago. I completely lost, like a lost sheep. But now, being a FENA member, I finally got my confidence back.
With this group, AHPN looks forward to inform policymakers by getting evidence from where it's really happening through the FENA members.
Our biggest priority over the next year is financial stability, to ensure that we're able to deliver the services that matter to the people that we serve. We also want to maintain and expand our service portfolio and build and develop new and strong, robust relationships with new donors and stakeholders.
We've got a new CEO now in place. We've got a team of very talented young people within the organization, backed up by a team of experts as well.
We have the knowledge, we have the skills, and we're currently using those to roll out the new AHPN profile.
These are challenging times. We're committed to delivering leaner, better and cheaper services, and I am excited.